So let's talk about health care reform. Now, there's a lot of ways we could start as to what Congress did, what the President signed into law. And there's a lot of things you can say. And look, I'm a supporter of the bill. I think it was incredibly important for us to move forward with health care reform. There's a lot more yet to be done. There are things that I wish were in this bill that aren't in this bill. And we'll have a chance to talk about that. Because I think there's a lot more that needs to be done. And there's a lot of ways that we can start our discussion. But I'm going to start with the first fundamental point and why I'm so proud to have been in the Senate to pass this bill. Because the United States, at long last, joins every other industrial nation in the world that says that health care is a right, not a privilege. At long last, we've gotten to that point. And for Maryland, that's particularly important because we remember DeMonte Driver, a 12-year-old who lived in Prince George's County, Maryland, right down the street, who had a toothache, didn't have health insurance, whose mom tried to get him to a dentist, couldn't find a dentist who would treat him, went to social workers. Social workers made numerous phone calls. Finally, his toothache got so bad, he had horrible headaches. They rushed him to the emergency room. His tooth had become abscessed, went into his brain. And what would have been an $80 visit to a dentist in order to take care of his problem ended up being a $250,000 two-operation procedure, and he lost his life in the United States of America in 2007, just 3 years ago. So we take personal in Maryland that we should have universal coverage, that every person should be entitled to quality health care in America, the wealthiest nation in the world. And the Congressional Budget Office, which does our scorekeeping. Now, you may know that Democrats and Republicans don't agree on much these days. We do agree on one thing, and that's the Congressional Budget Office. We think they're very conservative. We think their numbers, if anything, underestimate what we will achieve. Both Democrats and Republicans agree on that. And the Congressional Budget Office tells us when this bill is fully implemented in 2014, over 98% of Americans will be covered by health insurance. So we're getting there. We're getting to universal coverage, which is a fundamental principle that I think we needed to accomplish in this country. Second point, this bill is aimed at bringing down the cost of health care. We can't afford the cost of health care to our economy. The taxpayers can't afford it, and our economy can't afford it. We spend way more than any other nation on health care costs, in any way you want to go about doing it. And we don't have the results to demonstrate that type of investment. So again, the Congressional Budget Office tells us that over the next 10 years, the taxpayers of this nation will save over $100 billion as a result of the passage of this bill. And over the next 10 years after that, they'll save over $1 trillion. So we're making some progress in bringing down the growth rate of health care costs. And that's pretty dramatic when you realize that this bill spends a lot more money in a lot of areas. Spends money in primary care. Spends money in developing clinical programs. Spends money in giving subsidies to small businesses to provide health benefits for their employees. Gives subsidy to low-wage workers so they can afford health insurance coverage. Has more people covered by health insurance, which means the government's going to take in less taxes because there's more tax-preferenced income. All those cost money. So how do we bring down the growth rate of government spending and healthcare costs? We do it by investing in wellness, prevention, using health information technology in a more effective way, managing serious diseases in a more effective way, cutting down on readmissions to hospitals. All that's built into this bill as a way to bring down the growth rate of healthcare costs.